I'm Linda Duberly and I'm with Mark Britnell. Are you optimistic that healthcare professionals and politicians and people in general can go to your book and take real inspiration, in fact build the perfect healthcare system?
To give you the punchline of the book, I do say there is no such thing as the perfect health system, and it certainly doesn't reside in one country. And then I go on to say, out of the 60 countries I've worked in, there are 12 facets that I think if you put them together would make a brilliant healthcare system. Now, can you lift and shift different parts of health systems from one country to another? No. Can you adapt and adopt? Of course you can. All of these health systems were made by human beings like me and you, and therefore it's possible to take inspiration from other parts of the world and to apply it into your own country. What I also say in my book, if you think about the development of telecommunications, defence, or indeed pharmaceuticals and life sciences, all of these industries know how to compete and collaborate. And I'm saying really for healthcare, which is probably the most important thing that we face as human beings, one of the largest industries in the world, on average it consumes 10% of any country's GDP. We need to collaborate more effectively together. If my book can just play a small part in that, I'll be really chuffed.
If you were to look at a healthcare system, what would you say were the three key ingredients that you couldn't avoid if you want to be the gold standard?
Well, that's a great question. The simple answer is any great health system has to have three things: better health, better care, and better value. And what that requires in turn and simultaneously is political vision, political will, and funding.
It's funding that's such a big issue, and sometimes that involves changing the mindset of a government and indeed a nation. There are terrible difficulties inherent in that, aren't there?
Yeah, I mean, one of my chapters in the book is same problem, different country. And so in a sense, wherever you go, every country in the world, possibly with the exception of Switzerland, is facing pretty significant financial pressures. Ironically, of course, it's a sign of success. I mean, we've been, as a human race, living for about 8,000 generations. It's only in the last 3 or 4 that our life expectancy has moved from about 40 to the global average now is 75. So we're creating the preconditions for ever increasing human longevity, and of course that costs. And what I say in my book, especially in the chapter on ageing, which is called Every Cloud Has a Silver Lining, I believe it's a positive force for good. But we have to recognise there are problems of funding, and we have to address those sooner rather than later.
In a sense, we're moving from being a world that treats sick people to being a world that enhances and increases well-being.
That's a fantastic observation. So in my book I say that the 20th century was the age of healthcare, but the 21st century has to be the age of health. So soon we'll be entering a new age of healthcare called precision medicine, and that will tell you exactly what your genetic predisposition is to certain diseases. And once we know that, and we'll lock that door, we can start to talk about prevention and well-being.